Shall we start?
Yes, ma'am.
So, welcome you all to the New Year 2025. Hope you all had a nice celebration and welcoming of 2025 yesterday. So, this is the Gregorian calendar according to the solar calendar. Yesterday was the first day of the new year, that is 2025. Many of us don't have any special occasion on New Year. This is just like any other day, continuing our old good habits. But for most of us, this is a great opportunity to grab all the new vistas and new openings. We all want a start, right? To begin with. Even for children, when they are counting, no, they need a start like 1, 2, 3, 4. For playing the hide and seek, they need a start. For running, we need a count 1, 2, 3. For everything, we want a start. So yesterday, that is the first day of the first month of a new year altogether. So let this new year be a very great year for you to continue the good old habits as well as to add on new habits, new good habits, and with much consistency and with so much of interest and enthusiasm. Let us take the new year ahead. Okay. So, wishing all the young doctors and all the doctors here a very, very happy, successful practice. And I pray that you all get uh, the inputs, the knowledge to prescribe with confidence. And may you all become good prescribers and crack graver cases day by day. And whenever you are under confusion, go to the basics. Wherever, when you are interrupted by the maze of the, when you are having that confusion regarding the maze of symptoms, split the case in before you, on before you. Split the case into smaller ones. Look at analysis. Write the JOD, the journey of the disease, and sentence by sentence, disease by disease. What is this disease? Which layer is it? And which miasm is it? Then you will know ultimately what is to be treated in the case. Otherwise, you will be just drowned in the maze of symptoms and the sentences given by the patients. No. So now, again, once again, grateful to all of you, deep gratitude to all of you for giving me the opportunity to read Dr. Videkar sir's book, and humble namaskarams to Dr. Samuel Hahnemann and to Dr. Videkar sir. So now we are almost closing the theory of suppressions book. It is chapter 8 today. That is the proof of similimum. Hope you all are ready. Yes, so let's go. So in the last class, we have given Proteus 200 to that violent cough, small child, 4.5 years child. Today we are going to the next chapter, that is proof of similimum. Very interesting. How then to make out whether or not your remedy is the right one? Very important, right? There are certain criteria to be followed and examined when the patient comes for the follow-up. This is the importance of predictive homeopathy. In no other homeopathy, we give so much of importance to the follow-up. Of course, Dr. Kent has given us many guidelines to follow, like for the follow-up, like how to look into whether it is a good follow-up or a bad follow-up. The proof of correctness and right prescribing is provided by the patient himself. Yes. After a minimum dose, that is the similimum, the stimulus, the following changes could occur. Either it can be a good result or it can be a bad result, right? Disappearance of weakness. Is it a good sign or a bad sign? Are you all with me? Just give some thumbs up or some quick indications, no? Disappearance of weakness. Yes, it's a good sign, right? Normalizing of stamina and desire to work. Yeah, in how much time? We all say, many of us say, okay, homeopathy is very slow to act. Huh? After giving the first dose, whatever the condition may be, if it is the similimum, how much time does it require to show the initial sign that this medicine has worked? How much time does it need? Immediately, in the first 5 minutes itself, you can see, okay, the intensity of the fits has reduced, or the intensity of the fever has reduced, or even if the fever is 105.5, the child has opened his eyes and the child is looking, and he is moving his lips, he is asking for water. All these things can be understood in the first few seconds. And the coma and all. The moment the inhalation happens, the first reaction, the vitality comes back. Normalizing of stamina and desire to work. Restoral of original desires and passions, that is to read, to play, eat, study, wander, etc. Normalizing of sleep without dreams, normalizing of appetite and stool, increase in tolerance to aggravating factors, that is noise, sun, wind, cloudy weather, cold food, drink, and air. What does this mean? See, the normal intolerance. What do you mean by intolerance? This patient is oversensitive. That oversensitiveness or the hypersensitiveness will be reduced after the indicated remedy. With the same disturbing environment, this patient will be able to better cope up. Decrease in sensitivity to rudeness, offenses. You cannot change the husband, no? You cannot change the mother-in-law. After giving the medicine, what happens to the daughter-in-law? Suddenly the husband becomes a good gentleman, and suddenly the mother-in-law becomes the sweetest of the sweetest. How does this happen? And the persons who don't have job, they get the job, they crack the interviews just like that, and they get a very decent job. And all these things are situations around you which are changing for the benefit of the patient. All these things happen after the right medicine is given. This we all see, how many of you see all these things in our daily practice? You all have seen those for those girls where the marriage is not happening. Sometimes the mothers will bring with their jatakams, with their horoscopes. The mother will be coming here and telling, "Doctor, you gave medicine, and immediately that lady, the neighborhood remedy, she got married. Why my daughter is not getting married? You give her some medicine." No, is this a marriage counseling center or something? Huh? But then we are able to do all those things, no? Like patients do get the job and marriage or such good things happen, or if they are infertility, then automatically they get conceived and all these things happen. Why? Because the right atmosphere happens around us, no? Because homeopathic medicines are nothing but divine. Decrease in sensitivity to rudeness, offenses, or any other exciting emotional factors. People do say, no, my spouse has become much calmer after that medicine. Doctor, please give that medicine once again. Huh? How many of you have seen all these things? Tempering of tempers, reduction of fears and anxieties. Yes, the child or even the adult, they are able to break the barrier of the fear and anxiety and able to better perform after the right medicine. Disappearance of symptoms from higher layer to lower layer progressively. This also only in predictive homeopathy, this layer to layer reduction. And simultaneously, that is appearance of symptoms in lower layer of disease as well as in outward and downward direction. That is pain in the heart better, going to pain in the neck first, then the lumbar region, then the knee, further down to ankle, heel, and lastly the toe. And from the toe to cause acidity or diarrhea, and lastly to eruptions on the skin. What is this, doctors? Pain in the heart is which layer? Pain in the heart, which layer? Good revision in the new year. Pain in the heart, which layer? Yes, fourth layer. From there, the disease is going to the, it is coming up as neck pain. Neck pain is layer?
Third layer.
Third layer, yes. And then it goes to the lumbar region. Lumbar region, which layer?
Third layer, but
Third layer again, but then it is going above downwards, right? And then the knee joint is again the third layer, but it is still lower. Then down to the ankle joint, which layer? Again the third layer, but then again it is coming down. Then the heel is which layer? Third layer, again it is coming down. And lastly, the toe. Yes, the toes are also nothing but third layer only, no doubt, right? So, but the disease is from above downwards, improvement is seen. And after the toe, what happens? The pain in the toe is gone only to cause acidity. So when will this patient get cured eventually? So this is what makes a predictive homeopath different from the other homeopaths, because we always have a clarity of idea, like when will this patient be completely cured and when we can stop the medicine. What medicine are we giving? We are giving one stimulant, that's all. And then the vital force is keeping on and on and on. We're pushing the disease from inside out, from above downwards, from deeper layer to superficial layers. So from the third layer, it is coming to the second layer, that is acidity or diarrhea, that is the endoderm, and then it is pushed out onto the skin, that is the ectoderm. So now we know, okay, this is a complete cure. Yes, beautiful, right? Then the next thing is eruptions or pains on upper part of the body, like face and neck should disappear first, followed by the ones on trunk and extremities. When the patient is coming, eczema all over the body, you know what to, yeah, where the improvement starts first. You can even explain to the patient that, yeah, first of all, the eruptions on the scalp and the forehead and the eye, the face, the upper part should get better. After that, only the eruptions on the fingers will disappear. You can always tell this, and what the patients will say, there is a above downwards improvement, doctor. This will be the term used by the patient. Yeah. Now the next thing is appearance of any new lesion or eruption or pain above the level of already existing ones is a bad sign. Yeah, already we are having some skin layer or something, some eruptions. A new eruption is coming up above the old eruption. It is a bad sign. Yes, if a new eruption is coming below the original eruption, is it a good sign or a bad sign? One more eruption has come up. One more eruption has come on after giving the medicine, but it is below the original eruption. Is it a good sign or a bad sign? Now we said that if a new boil, if a new eruption of the same kind is developing above the original lesion, it is a bad sign. Now I am asking you, huh? If a new eruption is coming below the original sign, Dr. Adra is saying good sign, Dr. Sufaira is saying good sign, then somebody else is saying good sign. Yeah, there is a condition here. There is a point here to be observed, doctor. It is Brahmavidya is saying good sign. It is not blindly good sign, doctors. I refuse to say that it is a good sign. Why? What about the original lesion? The original lesion should improve. The original lesion should disappear. And a new eruption is coming below the original lesion is a good sign. The original lesion is there and one more eruption has come. It has come below or above, doesn't matter at all. It is a bad sign. It only means that the medicine given by us was not the right one. It was a wrong prescription. Or rather, the patient has not improved. You have to change the medicine. You have to retake the case and change the medicine. If the original eruption is getting better and a new eruption has come up below the original eruption, it can be considered as a good sign, or at least the vitality of the patient is improved. You know that in a short time, it will be, and eventually it will be a complete cure. So, which would invariably lead to suppression. Even I have seen a case where Vijay sir has shown long back at Kerala. It was a case of wart, many warts on the face of the child. Many warts here and there on the chin and there on the forehead, on the cheeks, etc. After giving the medicine, what happened? Some XYZ medicine, though mother came back with so much of happiness that all the warts upon the chin are gone. Then what about that on the cheeks? They are there. What about that on the nose? They are there. What about that on the forehead? They are there. But then tens and 20s of warts have fallen off from the chin. Mother is happy. But then sir was not happy. No, 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 this is in the wrong direction. It should go above downwards. And sir stopped the medicine right there, retook the case and gave another medicine. So this is the conviction of sir. We will be happy. Okay, 10s and 20 number of warts have fallen off. So this medicine has acted. We will be happy. No. But sir said, no, it is in the right, it is in the wrong direction. Change the medicine. Appearance of new ones below or on the extremities with disappearance of the lesions already existing is a good sign. Hope you have understood this. Now the next paragraph is the circular lesion should disappear. How should the circular lesion? Very interesting. Many of us have this doubt. The circular lesion should disappear by shrinking of the area of lesion. That is, here the healing should take place from outside in. This leads to cure. Contrary to the expectations, the local lesion, the cure cannot take place from inside out. That means the center should not heal first, followed by the edges. This is sure suppression, and one can expect a boomerang of the lesions and severe aggravation on the face and scalp or any higher up places. This center to periphery type of healing shall invariably be associated with loss of interest in work or reduction in stamina to work or disturbed sleep and bowel movements. Come on, what is this? So if you're having a ringworm, a circular eruption on the forehead, so that is disappearing. How is it disappearing? It was a black round circle, a ringworm. So atynia. So it is reducing from inside. It is reducing from inside, and it is remaining there. It is not spreading, but then it is reducing from the inside. The paleness of the color or the normal skin color is appearing. It is a bad sign. Even if the normal skin color is appearing from the center, it is in the wrong direction. It is in the wrong direction totally. So how this eruption of the skin should reduce? From the margins towards the center. The margins should be cleaned off first. And the surface area of the lesion should reduce. It should shrink. It should shrink. If it was some 3 centimeter eruption, it should become 2 centimeter eruption, 1 centimeter eruption, and then it will become a small papule, and then it becomes a macule, and then it disappears totally. So this is how, like, you can imagine that you are using a broomstick to clean a room. From where you will clean? You will not clean from the center, no? You will take one corner, the corner, then the walls, the corner, every corner. From every corner, you will bring all the dust and dirt to the center of the room. And from there, you will be taking it into the pan and throwing it out. So this is how, from the circumference of the lesion, the eruption should reduce and shrink, and then that is the periphery to center. Periphery to center. Hope you are all with me. Now we are going to the next thing. When skin eruptions are receding, okay, there is one more point there. And when you think that the eruption is getting better from the center, the patient is, how will be the energy level of the patient? Energy level of the patient is most important for us, right? For homeopaths. The energy level will be bad. Even though the eruptions are getting better, or even the normal skin color is coming from the middle, from the inside, from the center of that lesion, the patient will be having low energy, no motivation to work. Very often the patient will be feeling sick. His or her immunity also will be low, falling sick very often, getting diarrheas, etc. All these things are also good indication that the medicine was not right. So when the skin eruptions are receding, appearance of dullness, giddiness, loss of interest in work or sleep, reduced stamina and bad bowel movements, loss of appetite or appearance of joint pains, sneezing or burning urine is a definite indication of the ongoing suppression. Yes, guys, if the same treatment is continued, one can mathematically expect bronchitis followed by asthma or diarrhea or urinary tract infection, that is a respiratory tract or GIT or urinary tract, to follow the previous complaint without much delay. So if the skin eruption is going in the wrong direction, you will be getting layer by layer suppressions with a poor energy level and with a poor immunity. Yes. What about vitiligo? Vishalini is asking. Yes, dear, vitiligo also in the same direction. How? From the periphery to center. Periphery to center, vitiligo also. See, in vitiligo patches, many doctors know after giving the medicine, will see brown or black patches coming up, dots coming in the center. That is really bad sign. It only shows that our medicine did not work. It is not the right remedy. You have to reconsider. So ideally, how the vitiligo patch will reduce? The normal skin color or the brown patches, the melanin deposition will happen from the periphery to the center. Yes, that's how it should be. Now going to the next paragraph. Are you all ready? Vishalini, it's good now. Appearance of any deep infection. That is, patient suffering from acute conjunctivitis, parotiditis, jaundice, or any infections, diarrhea during the course of the treatment is a sure shot indication that the resistance of the patient, which the homeopath aims at building up, is not coming up to the mark, especially within. So when the patient is on the treatment, if he is catching any deep infections like jaundice or a severe diarrhea, it only shows that the immunity of the patient is not developed, which means our medicine is not helping him much. A single dose of the right constitutional similimum takes less than 24 hours. It takes less than 24 hours to strengthen the immunity in the endodermal derivative mucous membrane or respiratory tract, GIT, and urinary tract. So there will be no infections. Infections are the first sign. No, infections are SORA. So again and again, if the patient is catching infections, it only shows that, okay, our medicine is not the right one, or our medicine is not helping the patient to build up his immunity, which means it is not the simillimum, it is not the simillimum. Now, the next paragraph is, very often we find eczematous eruptions have disappeared from the skin, followed by suppuration in certain parts. How many of you have seen this? There will be long-standing eczema on the leg, chronic eczema, dry eruptions, black eruptions, thick skin, lot of itching and scratching until it bleeds. So much of thick chronic eruptions, especially in the extensor surfaces of the legs, maybe around the ankle joint, around the malleolus, around the lateral malleolus. Many of them do have lot of dryness and eczema, chronic eczema. These patients can develop staphylococcal boils. All that pinhead size boils or little bigger than that, a bead size boil, all yellow and full formed boils. One boil disappearing, another boil coming up. This is a real bad sign. This is what Vijay sir is trying to say here. Eczematous eruptions have disappeared. Sometimes it won't even disappear, and then again there will be all popping up of the boils, followed by suppuration in certain parts with large red inflamed, and these boils are painful boils being thrown up with fever also sometimes. This also is a bad indication, since one cannot justify exteriorization of disease with reduced immunity and increased susceptibility to streptococcus or staphylococcus. Our right simillimum should make the tissues and body parts unlivable and unthrivable places for all bacteria and fungi, and hence no need of antibiotics to get rid of them. Even if the patient is having a recurrent history of recurrent attacks of boils, that will be completely gone after giving the right medicine. The patient would have come for something else, for some hormonal imbalance. I have seen in my case, where I have tackled such cases with different varieties of ophidia. The patient will be coming up with hormonal imbalances, DUB, excessive bleeding, or adenomyosis, or chocolate cyst of ovaries. And they will be giving you a concomitant of recurrent attacks of boils in the private parts, in the lower abdomen, in the upper part of the thigh, one after the other, right gone, left coming up, left gone, right coming up, in the gluteal areas. Very painful, and it will be indurated. The entire area will be indurated and red and thick, and with the eye of the pus there. So this, one after the other, the attacks were coming up in the axilla, hidradenitis suppurativa. All these things are completely gone after giving the indicated remedy. Lacosis has helped me. Crotalus horridus helped me. Sencris had helped me. And many other, all these are for ladies who are having the bleeding issues. I have tried all these things and got rid of the boils as well. I did not give any medicine to take care of the boils. I did not give calcareous sulf. I did not give silica and all to, or hepar sulf to take care of the boils. I had only given the constitutional medicine, which happened to be an ophidia. And with that, once the DUB becomes proper, the bleeding or the menstrual cycle becomes regular without any trouble, the boils have stopped, which means the skin has developed its own immunity to ward off the staphylostreptococcal infections. Now the next thing is appearance of gum boils or aphthe in the mouth during the treatment of skin lesions is a bad sign. Yes, that is again going little bit interior, no, little bit inward. So it is a real bad sign. If a patient does not respond favorably, okay, let me give a question talking about the boils. If it was a syphilitic condition of the skin, okay, a syphilitic psoriasis or an exfoliative dermatitis where lot of peeling of the skin is a typical syphilis, typical destruction of the integument, complete exfoliation. After giving the medicine, there is mental well-being, okay, the first thing. And the patient started eating food, okay, and the patient gets that enthusiasm to come out of his bedroom and come and sit in the front room reading a newspaper, okay. But the patient is having a very, very painful staphylococcal boil in the back, in the sacral area. Only one boil, but it's very painful and the patient cannot sit. Although his mind says that he wants to come and sit in the front at least. Is it a good sign or a bad sign? Arya is ready with the answer. She says it is good, it will be good. How can we justify this? The mental generals are improved, the physical generals are getting better, the generals are good. That is good for homeopathy. But then what about this particular symptom? Just now we said that the immunity, we talked about the bad immunity. Chubangi is saying good sign. Yes, from the syphilis, it has come to the psychosis. From the, yes, Chubangi, it is syphilis to psychosis. So it is a good sign. So this mathematical equation has to be kept in your mind always. Just now we read and finished a paragraph saying that staphylostreptococcal infections are really bad, and then recurrent attacks of boils are bad, and that is lowering of your immunity. The medicine has not helped you. We have just now narrated all these things. But if it is a miasmatic reduction from more destructive to lesser destructive or to the constructive miasm, the suppuration and the induration are all what? Psychotic miasm. So it is a good sign in that condition. Every case will teach you something, right? There is no hard and fast rule, but then the theory should be hammered into your head. That's all. Apply the theory everywhere, apply the basics. So, the next thing is very interesting. This one is very practical. This is, if a patient does not respond favorably after single stimulation, you have given a single dose, little bit of improvement for 2 days. Again, the pain is coming. Again, you give the same medicine. Again, for 2 to 3 days, there is no trouble at all. Again, you are giving the same medicine. How long will you give the same medicine? Then you are bored of giving the same 200 potency. You jump into the 1M potency. Again, patient is improving. But then again and again, the relapse is coming back. Then what to do? Go to the higher. Okay, give 10M, give 50. How long? How much with the same medicine? So this is a sure short sign that it is partially selected. Yes, Sai Narendra. Yes, Arya. So what you have to do? Change the remedy. Change the remedy. This only shows that you are compelled to repeat it very frequently, which means it is not the right remedy. Totality should be taken again. If a patient does not respond favorably after single stimulation or relapses frequently or has to be given frequent repetitive doses to make a skin lesion disappear, be sure you are suppressing. Yes, this was the term I was searching for in my mind. This is sheer suppression. Very near to that remedy, maybe, but then you will have to retake the case. If let this partially indicated remedy not be a prejudice to you, Sai Narendra. Let you not be narrowing down your selection to the complementary remedy of this remedy in the hope that this has been a partial remedy. This has helped you cure at least for 2 days. So this should be a family of the same remedy. Don't get prejudiced with this remedy. Go to entirely new remedy. That will be all the best. Sometimes it can be an inimical also. In many skin conditions, it has been the inimical most of the time. When the sensitivity of the patient has increased, there was a case of causticum versus phosphorus. They are inimical remedies. The patient was recovering nicely with causticum. And suddenly the sensitivity of the patient increased. The eruptions, there has been redness and all, and the patient can't even touch the table, that much of sensitivity. So that is not causticum. So, but causticum has improved 90% of the case within no time. And suddenly this hypersensitivity. Then I think this case was narrated by Dr. Praful Borkar, and he immediately thought about the inimical remedy of causticum, that is phosphorus. And what is phosphorus? Is it a hyper remedy? Yes, hypersensitivity, oversensitivity and all will be there now for phosphorus. So phosphorus was given and it was tackled. That phase was tackled very nicely. So don't be prejudiced about complementary remedies or relationship remedies or follows well remedies. It can be the inimical also at times. Okay, so this was one input. Now the next thing is, if higher and higher potencies are required, yes, as we said, we are bored of giving 200 potency, belladonna 200 every day. No, not possible. Okay, let me jump into 1M. Okay, that has improved for a while. Now let me jump into 10M. What does this mean? If higher and higher potencies are required, That is, patient responds favorably to meserium 30, but relapses often, and later meserium 200 or meserium 1000 is given repeatedly to make the symptoms disappear. It is frank suppression. Okay. Now the next thing is disappearance of symptoms in reverse order of appearance down the chart of suppression is a must. Where cases are incurable, a stage of compensation is attained, wherein a disease symptom which is less morbid is created in the body and persists with a general improvement in all other natural habits, tolerance, and functioning of the patient. What does this mean, doctor? Give an example. I shall give you an example. Imagine that this is a cancer patient. How much can be cured? How much cure can be expected in a cancer patient? Fourth grade cancer. Yes? It is a real challenge, right? After giving the indicated medicine, what had happened? The fourth grade cancer, I am not saying that the fourth grade cancer is completely cured, but then there is lot of mental and physical well-being for the patient. But then the intensity of the cancerous cells that has also reduced. Maybe it is coming down from the fourth layer to the third layer, second layer, etc. That itself is a good sign. But then the cancer is still there. Yes. Eventually, what happens? Eventually, at the compensation of this cancer, a new disease has developed. The cancer is gone. The cancer is gone. But another new disease has come up, like diabetes. Like diabetes. And the diabetes is a very high value of sugar, 400. But then checking for the PET scan, head to foot everywhere, there are no malignancies. There are benign swellings here and there. The lymph nodes are all there. But then the malignancy is not there. The malignancy is stopped. The spread is stopped. The organs are coming back to normal with a high level of sugar. Is this a good sign or a bad sign? It's a challenge for you. Frank syphilis to psychosyphilis. Yes. Sai Narendra. Yes, Arya Devi. Yes. So this is called a kind of a compensatory cure, where sometimes we cannot expect full cure of the cancer. But then as long as this diabetes is there, the energy, as we said in the last class, energy can neither be created nor destroyed, but it can be transferred from one form to another. So from the bad, destructive, Sufaira, Shiny and all are saying good sign. Thank you guys. So from the bad syphilis, from the destructive syphilis, it is now getting better. And a new disease has come up, that is diabetes, but then still it is in the fifth layer, or even if it is autoimmune diabetes, that is better than cancer. So at least the spread of the cancer is reduced, even the malignancy is reduced, and the benign tumors are all there, the lymph nodes are there, but then the energy is shifted from more destructive to lesser destructive. Even diabetes can be destructive, right? But then it is of a lesser intensity. And what about the energy levels of the patient? Energy levels are better. Okay, so that is explained in paragraph K. Yes, where cases are incurable, a stage of compensation is attained, wherein a disease symptom which is less morbid is created in the body. So here, maybe an uncontrollable diabetes is created here. And it persists with general improvement in all other natural habits, tolerance, and functioning of the patient. Did you all get me? Yes? No doubts? Any doubt? Any quick discussion needed here? Okay. Are we good to go? In the above sequence occurs with the above general and mental improvement in all cases, acute or chronic, then and only then a homeopath is a right prescriber. So you can see all these things, whether it is an acute case or a chronic case or whatever case it is, you will be able to see the Herring's law in every case. So that is the end of this lesson. I think for 10 minutes more, we shall go ahead. No, after that, I think today Dr.Shyni is presenting the case. We shall go through the chapter 9 as well. Yes, different types of suppressions. All animate things in this world have to degrade. Yes, dust to dust, every man must. We are all mortals. Everything in this world has to degrade. On the other hand, every animate thing in this world has an innate instinct to survive. It tries all the forces at its disposal to live or survive in this hostile world. The world is trying to put you down, right? Many times it is like that. Can you please explain difference between forsaken isolation and forsaken deserted? When to take that? Oh. What is forsaken? Forsaken, isolated, and forsaken, deserted. Which are the remedies? Deserted means when you are not loved by anybody. Isolation means from a small island, not by the entire world. Forsaken, deserted will be like you are thrown out on the road. You are not loved by even by your mother. You are not loved by your husband. You are not loved by anybody. That is deserted. Whereas isolation will be, I am isolated in my school. I am isolated in my office. That is not deserted. Deserted will be much more traumatic than isolation. Isolation means in that pool, in that small environment, you are isolated. In the school, I don't have a name. I don't have a, I cannot show my face at the school. I am isolated there. Every time I eat my food and all in the lunchtime, I am ostracized. I am alone. Go to the toilet, I am going all alone. Nobody to walk with me, nobody to be friend with me. That is isolation. Deserted means nobody in the world love me. It is kind of going towards the existence conflict. Why should I live? There is nobody to help me. I'm totally deserted. I have nobody in this whole world. Deserted will be more of kidney pathologies will be coming up, right? Syphilis. Yes. Sai Narendra, is it okay? Good. So this
Thank you.
different type of suppression, this lesson. Thank you, dear. So this is really good to read. This is actually antagonism, no? The hostile forces are there always around us to kick us down, put you down, whereas we are using our innate force to live and survive in this world. Like Charles Darwin said, no, survival of the fittest. So what does this mean? One set of forces is always trying to degrade or shorten the life, whilst the other set of forces trying to defend and prolong life. Man is no exception to this rule. How philosophical is this? Everybody who is born in this world are mortals. We are all mortals. We all have to say goodbye to this world one day. So in this new year, this is a very good topic to discuss. How long are we all going to live? 70 years, 80 years, 90 years, 100 years, or 40 years, or 60 years? Who knows? Who judges this? Do you have any control for death in your hand? You have seen cases, no? Let me narrate the wonder of death. There was a patient, a coma patient. Yeah. He was under coma for 36 long years. 1 year coma. How will the relatives take care of him? At home, they are taking care of him. They have sold the house. They have sold everything. And they are on the road with this man. He was a great man once, but then due to some reason, he has gone into coma and he is not waking up from that. And he will wake up only for food. What kind of a coma is that? I'm not sure. But then he is reducing in his body mass. Day by day, he is reducing, shrinking, and total cachexia, and only head is there, Hippocratic face, all sunken, and he has got only breath and heartbeat. And brain death is not there. His heart is beating, his what to say? Coma means brain death only, no? Breath is there, heart is there, and food intake, little bit of porridge or something his wife will pour in his mouth, that 2 spoons, and output excretion will be there, maybe once in a week, little bit in the pampers he will pass, in the diaper he will pass. This is how he has been for the past 36 years. and he reduced in his body. And then what we all will pray? We all will pray for his death, right? We don't want this person to suffer like this, no, all with bed sores and all. And this wife was taking care of him so diligently that he has not developed any bed sores. Yeah. And that wife, the BP of the wife is she's having malignant hypertension, 220, with all the vertigo and such scenarios, and with no money in her hand. She was living an utter shameful life with this man, from home to home, with one daughter's house to another daughter's house, where this wife will have to see all the faces of the in-laws of the daughter. No, they will not sit quietly. No, even though the daughter want to take care of her comatose father, how long will the in-laws tolerate? 1 year, everyone will tolerate. 2 years, 3 years, 5 years, 10 years, 36 years. How can this be? And what use is that? So eventually this lady, I'm talking about death, keep that in your mind, okay? Eventually this lady fed up and she has come to the brim. There is nothing else to look for her than death for herself. But then without this man dying, she can't even commit a suicide. So she ultimately, with all her willpower, she took this man to an old age home. She first studied that old age home, where they have been very genuine in taking care of such people. She left this husband there. She turned back, and then this guy died there. The comatose person passed away in one day. Then what does this mean? This death line. Vijay sir used to talk about telomere. COVID patients, when they were admitted in the hospital, they all used to die just like that, no? But patients who were under our Protalus viridis 10M, Veratrum album 10M and all survived. And how did we administer the medicine? According to the speed of the telomere, according to the speed with which the death is approaching. With the oxygen mask, the patients are not surviving. In the ICU, the patients are not surviving. The patients who are, it is like a valley of no return. The patients are going into the hospital and the dead body is coming outside. One after the other in the ambulance, and there is a roadblock there because of the ambulances carrying the dead bodies. That was the scenario of COVID. And all those lucky patients, the lucky ones, the chosen ones from the above, are supplied with homeopathic remedies. We have done with our own hands, n number of cases. Even the patients whom we don't have any address, we don't know who they are, we don't know their faces, they are not in any acquaintance with us, they are not our patients. They will be the patient's friend, friend, like that. Please give me the Amrit kind of medicine. We just used to dispense it free of cost. What happened? They all survived. All those people. How mathematically, how calculatively Vijay sir has taken the rubric insanity suicidal. Because it is running towards death. The life is running towards running towards death. So in order to bring it back, you have to administer the medicine in the highest of highest potency. That too frequently, even every minute, they have been taking the medicine in the diluted form, or the comatose patient have been applied. The topical application has been done. And we have seen certain cases where the patient will be 60 plus or 70 plus, and the patient have lived their life. Suddenly they meet a fall, a bad fall, and they break the neck of the femur, and then they are bedridden. Bedridden for how many years? For 1 year? For 2 years? How many years they are bedridden? Why death is not approaching? What is the best mode of death? If it is a massive cardiac arrest, that is well and good, no? You don't have to know any pain of death. You don't have to lie down in the bed and suffer yourself and give sufferings to the others. Yes? Or there are deaths like after natural calamities. Yes, Monica Shanmugam. Death in sleep. And in certain cases, I have seen death in meditation. This is kind of samadhi. Death in meditation. They are already in connection with the, we don't know what to say. We tell it as Paramatma. Jivatma with Paramatma. In every religion, it is the same. It is only the mode of expression is the different. That's all. So that union happened, and suddenly the soul has left your body and left for the heavenly abode. Death in sleep. All kinds of different kinds of death. union with God. Yes. So why we talked about all these things, suddenly this topic of death came to our mind. Whatever life we are given, we are enjoying, every moment of it is so important. Until the death only we can do things. We don't know when the death is on our doorstep. We don't know that. Until the death, we can do all the works, all the studies, all the taking care of many things. So you all, in the beginning of this lecture, we talked about the start. Today the class is over. We shall talk about Dr. Shyni's case. Before that, better you write down or make a plan. As we said, this is a good start. The first day of the first month of a new year, this is the best time for you to think about your legacy. How many years you want to live? Maybe another 10 years or 20 years or 25 years or 30 years. Make a rough plan of that. And how much you want to achieve. What all things you want to achieve. You want to study, you want to increase your knowledge, you want to give back to the society. In what way you want to give back to the society? You want to take care of your parents, you want to take care of your family, you want to travel, you want to earn so much of money, you want to have bungalows, you want to have cars, etc. What are all according to your age group? According to your age group, what are all your plans for the future? For at least for the next 10 years, you just write down, guys. You just write down and make a plan for that. That will be the best thing to do for you to evaluate your life and to make use of the life, whatever life you have, make use of that life to the best and best of your ability. So thank you guys. On that note, let me stop and handing over this to Dr. Shyni.
Hello, ma'am. Can you hear?
Yes, dear.
Okay.
Go ahead.
I'll try to share the slide. Can you see the slide, ma'am?
Dear.
Yes.
Okay.
Yes. 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 No. Okay. It is a chronic case. It is a case of cholelithiasis, choledocholithiasis with cholecystitis. And I'll show the presenting complaints. I hope you can see the slide now. The presenting complaints were severe pain in the right hypochondrium and since 10 days, pain extending to the back and right scapula. Pain is continuous with chilliness and sweating, sensitive to touch, aggravation of the pain is while breathing, and she was having continuous vomiting. The conjunctiva was yellow, and she also has a history of 10 years of gallstone and also history of bleeding piles. Okay. So when she came, actually she took the appointment. Her daughter called me one day, and that day it was around 8:30. So it was my time to close the clinic. I told today I don't have time. I'll see you next after 1 or 2 days. I gave an appointment. She was actually pleading, the daughter. My mother is very sick. She is crying with pain, etc. So anyway, the next day they came, and when they came, this was the complaints. Okay, and her appetite was very less, thirst was more, and the motions were white pasty stool since 2 to 3 days, and urine was dark colored and burning. So then I asked about the conflict, what she is suffering. So I have written in the slide. She got married at the age of 17 years against her will. Her sister eloped just before her marriage, that is, her sister's marriage was fixed with a person. But before the marriage, she eloped with somebody else, her lover or somebody. So the patient was forced to marry because all arrangements were done. There was no other way. So the parents forced this patient to get married to that same person. She was forced to marry to the man to whom the sister's wedding was fixed. And he was 15 years elder to the patient. So she didn't like it all, but there was no other way because the parents were very much forcing. She accepted it. And after the marriage, the patient was telling like he was not treating her well. The patient told that she didn't get love and care from the husband. She was forced for the sex, etc. So she was not at all happy with the married life. First reason was she didn't like him to get married. She wanted to marry a person whom she likes. But this was something which was very forcible. And this husband was having a business which was going very well, and they had their own house and all those things. And meanwhile, after getting married, she used to get recurrent rhinitis. For that, she was taking some homeopathic medicine. This patient is allergic to allopathic medicines. Whenever she takes allopathic medicine, some allergic reactions will come. So she was always sticking on to homeopathic medicine and with some other doctor. And uh, as the time passed, they had two children. Both of the children were girl children. She also was working. She was an educated lady, and she was working in a school. And maybe because of the mental tensions, etc., she one day when she was taking class, she develops fits, and she fell down in the classroom, and she became unconscious. They have to take her to the hospital, etc. So the children told not to work because she is very weak, and husband also told, okay, it's okay, you can leave the job. So she left the job. And later she came to know that the husband had lot of loss in the business, and he had taken a huge amount of loan. So all these things she didn't know it. Husband never told her about all this. She came to know only when all the people from whom the money was taken, they started coming to home and asked for money. So she felt very embarrassed because all those who came to ask money started using bad language, scolding her, your husband is not paying money, etc., etc. And at the same time, because she had two girl children, right? So it's not good that some other gents coming to home and asking for money. So all this affected her very badly, and she thought I should not have left my teaching job. I should have continued that job. At least I could have earned some money. And this the husband, he sold their house. They had to live in a rented house. The patient's jewelry also was sold out, and in order to what you call pay back the money, he will take loan from somewhere, he will pay that money to other person, again he will do that. This continued. It was a rolling on business of taking money and giving to others. So they were into too depth of too much money came on their head. So then this lady started asking, and the husband also, he stopped going for any work. He is actually a good tailor, some tailoring business I think he had. He is a very good tailor. So she asked, like, you go and do some work. Then he was not going for any work. He was very irresponsible. And if the lady asks the husband to go for work, he will tell that he threatens them and says he will leave them and go. I will leave you and your children. I will go somewhere else. You leave alone. That is the word that he used when the patient asked that husband to go for work. So she felt very bad. She felt neglected, and she felt that I should not do some good to other people. She felt too much angry towards her husband and others. At the same time, she also felt, why should I live such a life with this girl children? Okay, so at the same time, she started getting some money. Started in the sense, she asked her parents, and then they gave some money, and with that help, she taught her both of her girl children. And the patient said, I am not safe with my husband. There were incidences where other people misbehaved with the patient, and husband did not respond. Always she was worried about the children, people coming home asking for money even when the husband was not at home. Children grew up, they were good in studies. Later, the elder one got a good job, and she slowly started repaying the debts. Like the husband was not repaying. This girl, she finished her architecture. She got a job, and slowly from her, she also used to get a very minimal amount of salary. But from that, slowly, they started repaying the debts. So the patient told that she feels safe with her daughter than her husband, after she started earning, though there are debts yet to be paid. And at the same time, she had too much hatred for her sister, that sister who eloped with the other person, because she was the reason for all this. Because of her, I am suffering. She told, I want to see the suffering of those who has done bad against me. That is especially to the sister. And they should understand my pain. And the patient, that is the cause and the conflict. The patient, and as a person, she is very fair, good looking, neatly dressed. Her hobbies are dancing, singing, allergic to allopathic medicines, sensitive to sun headaches, a very angry person. Especially she is angry to those people who has done bad against her. And also she is little haughty. And she came with the report, okay, and the USG report was on February 28th. CBD dilated 10.6 millimeter. There is a big calculus in the CBD, common bile duct 9.6 millimeter, and gallbladder stone was 1.36 centimeter. And I asked her to do the LFT also. That also was very high. SGOT, SGPT, ALP, GGT, everything was on a very higher level. So if you have any inputs you can give, then I'll tell you the remedies.
Nice case, guys. Come on now with some inputs. What all rubrics can you think about here? Interesting case. See how the gallbladder stone has, how the soil was created for the gallbladder stone to form. Since it is continuous process, what was the perception of the patient?
When she came to me, actually she was having gallbladder stone for 10 years, madam. She came to me in March of 2023. So before that itself, she had gallbladder. She had gone to some other homeopathic doctors and they were giving some medicines which did not help. Shall I continue? If
Yes,
there is
continue, Shyni.
So according to GNM, a duct or a passage gets obstructed when a person feels, I don't want to throw out something from inside, or nothing should enter inside from outside. So here it was actually a very dangerous situation because the CBD was blocked with the stone. And because the CBD was blocked, it can cause damage to the liver. So here the duct was blocked. So what my understanding is, as all of you know, the gallbladder gets affected when there is some financial insecurity. So this lady was having a very severe financial insecurity because they had a very good house that was sold. Too much of debts were there. So whatever money she had, she didn't want to lose that money. Okay, that is why that CBD got blocked with the huge calculus. And the rubrics which I considered was death desires, delusion, injury about to receive, and abdomen pain, liver, colic, gallstone. So in the repertorial totality, just a minute. Belladonna, beriberi, lachesis, lycopodium, sulfur, mertsol, naxwamica, opium, silesia, and arsenic came. So the pain was right-sided, right hypochondriacal pain was there and shifting to right scapula. So the remedy should be a remedy which should act on the liver. And then total bilirubin count was very high. So total bilirubin count high means there is a lot of destruction of RBC. Okay, so because of that, as well as the patient herself was saying, like, it is better not to live like this. I don't want to continue the life. That is why I took the rubric death desires. And the remedy which acts on the liver is Crotalus horridus. Though in the repertorial totality, Crotalus was not there, but lachesis was there. So I chose Crotalus horridus, 201 dose was given. And I asked her to do the LFT every week. So by next week, after 1 week, slowly all the readings started coming down, and that like Vijayakar sir has taught us, like first SGOT has to come, SGPT, then SGOT, then ALP, GGT, and finally bilirubin has to come down, but hemoglobin level has to be maintained always on the normal values. So in that same order, I myself was wondering how this happened. So every week the reading came normal, slowly it came down. And this is the report which I had already told you. And after, actually what happened is, even though the LFT readings came down, after a month, all the LFT reports became very normal. And I asked her to do the scanning after 2-3 months. The size of the CBD stone came down. Okay. But after 1 more month, what happens is the CBD stone level again increased. So I repeated 1 more dose of Crotalus horridus 200. And then it was the what you call all SL was, I was continuing with SL for a long period of time. And then after I think 6 or 8 months, again I took scanning. Again, the stones were still remaining. So what was done is Crotalus horridus 0/1 water doses. I gave for 100 ml for 1 month. That is 1 teaspoon per day for 1 month. And this year, that is 2024, this is a report. I hope you can read it. No evidence of calculus in proximal CBD, mild distal CBD obscured, and this is the final report, madam. So all the stones have gone, all the complaints have come down. She had bleeding piles also, that also came down. Thank you for giving me an opportunity to present this case.
Wow,
Yes,
wow, Shiny. Well done, dear.
thank
So
you, ma'am.
Crotalus horridus is I have seen cases of Crotalus horridus. I think even Dr. Adira has been telling one case of cholelithiasis where she has effected the cure with Crotalus horridus 200 single dose.
Okay.
So
And
brilliant.
one more, can I tell one more sentence, ma'am? Like after May was the last this scanning done this year, May, and she wanted to work again. And luckily by May she got a job, ma'am, as a teacher. She started working from June. Now their financial problems are getting solved one by one. And husband also, one more thing is husband started working. He started going as a tailor. There is no problem between husband and wife. They are happy. But still, one more thing has to happen. Like with her parents, the relationship is not so good. So I am hoping that also will come back to normal. Thank you, ma'am.
Maybe. Very good, dear. Maybe this was maybe the effect of some Mahakaran involvement or something would have been there. Anyway, the circumstances, no, as we said earlier, the circumstances are also getting better. And then there will be no need for the gallstone to get precipitated in her body. And there is no anger, so that there is the gallstone is not getting obstructed in the CBD, in the CBD, in the bile duct, in the common bile duct. See, all these things are actually the soil seasoning, no, and seed. So here the soil was already there. She was pushed into the marriage. How unlucky. And because of her sister, she had to suffer all these things. How nicely it had reached Crotalus. Very nicely selected. And now the entire situation is changed so that there is no need for the liver to be angry, for the gallbladder stone to be formed, and then the obstructive jaundice to be formed. Nothing is needed now. And she is happy. She got a job. Husband is also going for job. Slowly, they are in good terms also. They are able to clear off their debts. Everything, no, the divine interference is there. All after a single dose of Crotalus horridus 200. Well done, Shiny. Well done. So this is the magic of predictive homeopathy. So that was really a nice input. So once again, dears, he came out of that sepsis. Yes, Sai Narendra. So let us all continue this class of reading and learning and sharing and putting the knowledge into our practice and healing the patients day after day, more and more graver cases. Come and present it here. Till then, good luck. Bye and Happy New Year again. Thank you so much.
Thank you, ma'am. Happy New Year, ma'am.
Thank you.
Thank you.